Now, these 6 layers of resistance, these can come up at any different stage here as well. So disagreement on the problem, a really common one. We're solving a lifetime buildup of subluxation, and they're solving headaches that started last week. Now, once we agree on what the problem is, then it could be a disagreement in around the solution. And so when we're trying to talk to them about the solution, here we need to have different ways to explain it, different models that we can explain. We want to have testimonials, case studies, research. The third one is a lack of confidence in the ability to implement the solution. I agree on the problem. I agree on the solution. I cannot see how I can fit this into my life. So we want to dive into this. How would we find out? Level 4 is concerned that the solution might cause side effects. So again, they've got these issues in around frequency and duration. And really what they're saying is, I'm worried I'm going to get hurt. So we need to find this out. So tell me a little bit more about your frequency. What are your concerns there too? I'm worried if I get adjusted this often that maybe it'll make me worse. Number 5 there is overcoming objections to the solution there too. These are administrative. How am I going to manage this? And number 6 here is a psychological resistance to change. We've all had those patients that have bought into their problem. There's secondary benefits to their problem. And if we're to help get rid of it, that's going to cause problems. But we need to spend some time clarifying the objection. And there's no simple way to do this other than understand that there's different layers of resistance there. Ask open-end questions. Tell me more.